Well, I'd like to welcome everyone to our second in our three-part series featuring Dr. Debbie Joffe Ellis and her expertise on Rational Emotive Behavior Therapy. For those of you who were not with us last week, we got a wonderful introduction to REBT and discussion on how it can apply to a lot of what we're coping with the COVID-19 pandemic at the moment. We're going to continue that work today. And before I give the introduction, I'd just like to inform everybody that this is another webinar hosted by the International Council of Psychologists, an association committed to human rights and social justice around the world. I'd like you to know that we have several hundred people watching this webinar today, and that we will spend the majority of this session presenting Dr. Joffe Ellis with questions in real time. Some people have posted their questions already, and some people will be posting them during the discussion. For those of you who do have a question, I'm going to ask that you go to the bottom of your screen and you'll see a small icon that simply says Q&A. Please simply type your question into the Q&A chat, into the Q&A icon, and we will collect them and try to present as many as we can. Please, we ask that you be concise so that we can include as many questions as possible, okay? We will be lucky enough to get this information from the leading expert in the world on Rational Emotive Behavior Therapy. I suppose most of you already know Dr. Albert Ellis, the founder of REBT, is one of the most influential psychologists in all of history and certainly of the last century. And Dr. Debbie Joffe Ellis is continuing his work today. She is a renowned expert in conducting this form of therapy. She's been recognized for her work internationally, and we're very lucky to have her here with us today. The format for this webinar will be a presentation that will last for a bit, and then what will happen is I will come back on the screen and we will begin presenting questions. So, Debbie, are you ready to do your introduction?
I am indeed.
Okay, so please just go right ahead.
Thank you very much. To start, I want to thank Dr. Andy Simon and Dr. Mary Bullock, who's putting this all together along with Dr. Simon. She's behind the scenes, and I want to thank all of you who are there viewing live, and hello to any of you who are watching the recording of this after the fact. Heartfelt thoughts to any and all of you who are suffering in any way, and my hope is that what I share with you today, or any part of it, can be helpful. One of the main messages that I want to convey and remind you of, particularly those of you who didn't hear the first webinar, although by going to the ICP website, I believe you can see a recording of it. One of my main messages is that if we so choose, we have the power not to be affected by outside circumstances, no matter how dire. Of course, the exception is if we're so gravely ill that we're not able to be aware, if we're in such physical pain, or in any way physical deprivation, that such words would not be able to be understood or even embraced, and obviously people very near to death. But for the rest of us, for any one of us participating here or watching it after the fact, we can choose to go along with a kind of general vibe right now that's being reinforced by not all, but some people in the media, be it on screen or written media, friends, family members who don't realize that they have the power to control their emotional destinies, and they don't have to succumb to attitudes that can create intense fear and anxiety. If we are aware that it's our attitude and our thinking. And I'm not talking about Pollyannish, unrealistic, romantic, la-di-da thinking. I'm talking about realistic, optimistic thinking. And hope, embracing hope is core to surviving well during times of challenge, during times of crisis. Because as the cliche goes, but there's truth in cliches, or they wouldn't be so commonly used in some cliches. Where there's life, there is hope. And hope can be one of the greatest sustainers and stimulants of resilience known to humankind. And so if we hear messages like it's terrifying, it's awful, unprecedented, and we allow ourselves to not question those assertions, we can hardly be blamed for thinking in similar ways and then creating more anxiety, panic, fear, or whatever the debilitating emotion might be. Last week, I gave a very speedy version of the basics of REBT. If you didn't hear it, I invite you to listen to it again through the recording through ICP website. And if you did hear it and want to, feel free to hear it again. But to remind you that we humans have the ability to think in rational and irrational ways. If we know that there's a difference, if we're educated in that. And when we think in irrational ways, in response to genuinely difficult circumstances, when we think in irrational ways, we create debilitating, unhealthy emotions, which include panic, fear, depression, guilt, shame, rage. And when we think in healthy ways about the same circumstance in a realistic, optimistic way, then we create concern instead of panic, fear, and anxiety. We create appropriate grief and sadness and disappointment instead of depression and hopelessness and despondency. We create a kind of healthy, ethical, moral kind of anger that we're in control of rather than rage. And we create, when we think in healthy, rational ways, regret instead of shame and guilt. And so it is vital, if we want to, in this one finite life that we have, it is vital to learn the difference and to make the choice to not succumb to previous habitual attitudes and ways of thinking that create the unhealthy emotions that keep us down or worse during difficult times. And for many people, this is a difficult time. Now, I'm saying for many people, because I'm going along with one of the assertions of REBT, which reminds us to be careful about overgeneralizing. For many people, it's a difficult time, particularly and understandably for people who are either experiencing illness or concerned about loved ones or people they know, or just individuals in general who are ill, dying, And yet there are many people who, whilst having compassion and genuine sadness and grief for those who are particularly suffering in the ways I mentioned, they are also choosing to focus on what still is good in their life, what they can be grateful for. Not instead of, not to deny facts. Facts are really important, but both and. And by doing that, by fueling our ability to choose, it's a choice, to remember daily, more than once a day and night, what's still good. If we're able to hear this, watch this, listen to this, we have already much we can be grateful for, despite the difficulties and the losses and the suffering that some of us may also at the same time be dealing with. Hope is what sustains the human spirit. Hope helps keep immune systems stronger, and hope helps keep us alive and give meaning and quality to life. Meaning in life is something we choose. Some people don't bother because they've never thought about doing so. But for those of us who are willing, again, through choosing healthy, realistic attitudes, we can enrich our lives during times like this. I know of people who, whilst feeling compassion and suffering for others who are suffering more than they are also using this somewhat downtime to get physically fit, to be mindful of eating in healthier ways, to get more creative, to use more of their skills, and very importantly, to help other people in whichever way they can during this time of restriction. You know, one of the aspects, REBT talks about the importance of enlightened self-interest, of cherishing life and making healthy choices for oneself. And part of that is choosing to help others as much as possible. So by developing, maintaining and expressing via phone calls, emails, Zooms, whatever, and still postcards, for those of you who do that, and inspiring others, especially those who may be having harder times than any one of us. We're contributing not only to our own well-being, but as importantly to that of others. And you know, situations like the one we're in with this global virus reminds us of the similarities in the challenges that every human being faces, albeit some of us are immeasurably more fortunate than others. Last week, one of the questions pertained to people in countries and communities within them who are suffering in survival ways, insufficient water, insufficient food. And at the time, I think my response was, you know, it's to be hoped that organizations and agencies provide those basic survival needs. But I was reflecting after the webinar last week, and I also fervently hope that those people who are bringing those practical necessities for life to such individuals also do what they can to instill hope, to look for people within the communities who might be stronger, wiser, healthier, who can in some ways teach other members certain skills. You know, if people in such communities feel totally dependent on outside help, they can feel like victims. And REBT reminds us that one is only a victim if one tells oneself one is. Now, one may be experiencing consequences of dire situations in nature, in the community, from other individuals. And we may be disempowered to act in certain ways. But if we know we have the power to be self-sufficient, then we can still be empowered to not succumb to those unhealthy emotions of despondency and find some ways creatively to elevate ourselves and others. Hope is important. If I don't have time today, perhaps next week in the final of these series of 3 webinars, I can share with you a somewhat personal experience relating to what my parents went through. Some of you may know that they survived 5 years in concentration camps. And there were a number of miracles that contributed to them surviving. And one of the elements was that they stubbornly refused to lose hope. although much of the evidence did not support hope. But it was a choice, and each one of us has that choice. So a few final words, and then I'd love to hear your questions, especially if I can answer them adequately. I'll do my best. Let's work on dropping any need for certainty, because as I said last week, this situation has certainly pointed out that nothing is certain. And let's do our best to be willing to accept the unexpected. Not many of us a few months ago expected we'd be living a life the way we are right now. Many people had many other plans for their work life, for their leisure life, in more privileged countries, of course. And what do you know? Well, even without the virus, you know, if we're adult enough to admit it, if we put the magnifying glass on months of our past, on years of our past, didn't things sometimes, or often for some, happen out of the blue that redirected us from the path we thought we should be going on? Should, another demand. I talked about those last week, but I won't get into that now. And so when the unexpected happens, which is part of life, not just viruses, tsunamis, hurricanes, all sorts of things happen in life that we often don't expect or anticipate. And if we can choose to work on not only accepting, but frankly embracing the fact that there is uncertainty in life and some things happen that can't be anticipated, and to adopt a philosophy, well, who knows? Just because I thought I should be doing this and now this happens and I'm having to go in this direction, it's highly possible that if I choose well, because now I happen to be in this direction, I might look back on this year and see what a blessing. Because if I'd gone this way, maybe what I developed or experienced by being forced in a way to go that way wouldn't have happened. Let's fuel the fire of optimistic realism, of helping others, of remembering what we can be grateful for, and cherishing the gift of life. A number of us are suffering more than others. If you're watching this, you're suffering a lot less than many others. Let's be grateful. And now, any questions?
I just want to broadly say thank you. Is the audio okay, Debbie?
I can hear you.
Okay, fine, good. Debbie, we have quite a number of questions coming in. So one of the common themes is that there are people that are stuck in their homes, obviously. Many of them are alone. And this seems to be exacerbating feelings of depression, anxiety, social isolation. Can you just speak to what they could do, especially people who are in lower income regions or in developing countries where they don't even have access to therapists, whether Zoom or that's not even an option for those people?
Sure, with pleasure. Great question. An aside that's related to that. In my view, effective therapy is only effective if the client takes action in between sessions. In my view, effective therapy isn't about, you know, just expressing and revealing. I'm being a bit trite here, just go with me. Unless, in addition to that, and that can feel good, it is good to express, but often effective therapy will provide psychoeducation, and certainly REBT does this, and point out to the person how they're thinking in self-defeating ways and teach them, as I mentioned last week, and you can look on my website for the self-help form, how we can choose to dispute unhealthy thoughts to create healthy emotions. So my point is, even if you can afford therapy, because Dr. Simon rightly said, a majority of people in our world cannot. Either it's a luxury, in some places there's still a bit of a stigma. And so even if you can, what's most important is how you live between sessions. And if you can't afford therapy or don't want it, what's most important is how you live in your moment. So to answer the question more specifically, people who are isolated, living on their own, as Dr. Simon described, if you're feeling depressed or despondent, I urge you to take time, you've probably got time, to write down what are you telling yourself to make yourself feel depressed. Is it something like, this is awful, I can't stand it, limiting irrational beliefs? I hypothesize it's highly likely that's the case. And what often happens when people don't realize their thoughts create their emotions and they have a choice about how they think during difficult and undifficult times is the old habitual beliefs come up. Awful, terrible, can't stand it, shouldn't have to be like that. And they stop. And so they stay marinating in the resultant ache. And so when one is willing to question those beliefs, where is the evidence that I can't stand it? I don't like it, it's not very likable, but I can stand it. And then bring in a little reason. In all probability, this is going to pass. And so to challenge the ideas that have us believing that it's awful and terrible, because where there's life, it could be more awful and terrible if you were really on death's door, had no food, shelter, water, and it's my hope that all of you and your loved ones have those adequate survival needs met. And so by disputing the beliefs, so that's one thing, to get into a healthy frame of mind. Read Dr. Frankl's Meaning of Life, the way that he was living in a concentration camp and found meaning and even moments of enjoyment. And again, if there's time today or next week, I'll tell you a little about my parents' own experience. So if we're willing to examine our thoughts, question them, get a healthy perspective, that doesn't mean saying, oh, this is okay. It's not okay, but it's bearable. If it wasn't bearable, you'd be dead. And then, excuse me, sniffles. I'm not ill. I don't have the virus. I think it's an allergy. So I'm very healthy. You're not going to catch anything from me, anyone. So get a healthy perspective. And then the next thing I recommend is to be creative. By the way, there are people who choose to isolate themselves at times where there's no virus. People who go to ashrams or yoga schools and certain schools of meditation. Vipassana, you live for about a month and you have to be silent, and a lot of introspection and reflection. And given that now we have this enforced somewhat isolation and restriction, to look for what can be beneficial, since it is in all probability just a chapter in our life. You know, hopefully we'll get out of it. Hopefully we won't need to re-emerge if too many people act in foolhardy ways and then there's a new spurt of too many hundreds of people getting the virus again. But so in conclusion, think about your thinking, challenge the self-defeating thoughts, replace them with encouraging thoughts. Remember, a healthy perspective, this isn't forever. Our lives aren't even forever. Think of things you can look forward to that you want to do when the restrictions are lifted. Make plans. Again, be creative, be silly, draw, write, dance. and do something for others. Get out of yourself. In terms of being creative, those of you who can leave the house with a mask and go for walks and keep a distance, which is one of the things I do, I found a certain freedom in wearing my mask, because I often have my buds in, I'm listening to music as I'm walking along, and sometimes I'm listening to Motown or whatever. And in the past, without a mask, you know, I've maybe sang along in my head. And now with my mask, I give myself the freedom to sing out and allow myself to choose to experience more freedom, which, by the way, when this is all over, I can still choose to do without a mask. I'll see what the consequences will be and how many people say. Anyway, they're my two main plus suggestions.
So Debbie, we have a lot of therapists that are here and have general questions for you, okay? So speaking to our colleagues that are actually providing counsel to other people, can you give some specific examples and techniques of thought challenging, and for people who are able to reach therapists who are stuck, clients who are stuck in their homes, can you walk us through some specific techniques that therapists can use with clients who are struggling through this?
Sure, another great question. So I'm speaking from the standpoint of rational emotive behavior therapy. Other approaches might emphasize other things or not emphasize the things that I do, but so I'm speaking from that position. First thing that I would like to suggest to therapists and counselors who aren't necessarily licensed therapists and people who are in whatever capacity trying to help other people. Prevent burnout, you know, and set boundaries. And whilst it's very helpful to our clients when we show empathy and compassion, which my hunch is most, hopefully all of us genuinely feel, REBT also asserts that that's not enough if our goal is to equip our client with the tools for greater self-sufficiency, which is the core of your question, I think, Dr. Simon. And so here's what I would recommend. After listening, obviously, as appropriate, expressing genuine empathy and compassion, to point out to the client their self-defeating beliefs, particularly if they're not aware of REBT, you know, and you can use a language that's familiar to them. I don't necessarily mean, you know, English, Chinese, Indian, whatever. I mean the vocabulary that you use with your clients. It doesn't have to be academic or therapeutic kind of words. Just, you know, it's important to speak at the level that the client can understand and not have to ponder. And so in the way that you, the therapist or helper, think is most helpful, just say, you know, what I'm hearing you say, client, is that you're furious because this particular person in power is da-da-da. Where is that getting you? So one of the questions, or I hear that you're very despondent because your neighbor, da-da-da-da-da. I hear that you're very anxious because da-da-da-da-da. So you reflect back, you clarify or give them the opportunity that they are confident that you understand what they've said and where they're coming from. And then gently or assertively, depending on what you think your client will best receive, ask questions like, regarding these beliefs that I hear you telling me, firstly, where is it getting you? To think these things and then to experience the resultant anxiety, despondency, rage, whatever the emotion is that you might be working on to help them change because it's self-defeating. So where is it getting you? Is it helping or hurting? That's a pragmatic way of exploring their beliefs. And then the question, where is the evidence? Even though it's bad, give me the evidence. It's the worst thing ever, that it's the most awful thing, that you really can't stand it. Where's the evidence? Where is it getting you to demand it shouldn't be the way it is when it is the way it is? Can you change any of those things? Go for it. Some of the things, in all probability, our clients or whoever we're trying to help can't change something. You know, we can't change the level of the virus status right now as individuals, perhaps. But so given that we can't change certain things, where is it getting us? Say it shouldn't be the way it is when it is the way it is. And so you're encouraging acceptance of that which cannot be changed, encouragement of creativity and hopefulness, and resilience towards things that can be changed. Provide humor if it helps give a balanced and healthy perspective, but with sensitivity. Make sure your client gets your sense of humor, or it actually might do more harm than good. They might think you're mocking rather than trying to give a healthier perspective. And then ask them, perhaps. So if I were you and you were me and you wanted to help me feel better, what might you suggest to me? That's kind of reverse role play. Another thing I would suggest that clients and helpers can do in their desire to help others is to use, and by the way, everything I'm suggesting, these are REBT techniques, and I'm only going to select a few because we don't have time for me to tell you all. But another one I'll mention now is modeling. And that's where we can ask the client or whoever we're helping, look, do you know of anyone, can you think of anyone either in your personal life or that you've heard of in your ancestry, or someone famous that's known in the world who's gone through something as bad or even worse than what you're going through, but they recovered, they did well despite and including that. And usually my experience is people have come up with someone or more than one person, and if they're having a hard time, I can suggest people, again, depending on the country, culture. It might be a Mother Teresa, a Martin Luther King, Nelson Mandela, a famous creative person who's using their wealth to help other people. So, you know, and so the reason it can be helpful to find other humans who've achieved that which would be good for the client to achieve is it reminds them it is humanly possible. It's possible. Because otherwise a person can feel too removed and these other people, well, if they did it, but, no but, you know, if we're aware, if we make the choice, if we have techniques, we can, in all probability, get through this and get through it well, and sometimes flourish and frankly even benefit as a result. And when we flourish and benefit, one of the potentials for human life that enhances us as individuals is to help others, even if not professionally, just as examples of being stable, content, tranquil, and compassionate during times of challenge and brutality and trial.
Thank you, Debbie. Thank you. Debbie, I'm just going to move to some next questions here because we have a lot of people who would like to hear from you. We have a colleague in Pakistan who notes that in his community, people are perceiving COVID as a curse from God, and they are praying a tremendous amount, and even having their small children in their family praying a tremendous amount. Can you speak to how these people can be supported by therapists?
Yeah, another great question. Again, I'm speaking as an REBT practitioner, philosopher, and REBT is more than just a therapy and philosophy, as I've mentioned last week. It's also a way of life for those who embrace it. So, according to REBT, it is not the role of the therapist to question a person's religion, faith, or spirituality. It's not our role to try and change it. So if there was a therapist who thought, well, that's silly superstition that they're praying and it's ridiculous, let me try and make them more rational and realistic. In my view, and in the view of REBT, and I think of other schools of psychology, that would be unethical. And so what I would suggest as a therapist talking to individuals in such communities, first it's important to clarify what is their difficulty. You know, apart from the obvious fear of getting ill and dying, the fear of your loved ones getting ill and dying and so forth. If there's anything in addition to that anxiety, to get clear. An effective therapist in REBT and other schools of psychotherapy, in the early stage, clarify what are the therapeutic goals? You know, how can I as a therapist help you? And so to get clear, going back to this community in Pakistan, what does your client come to you for? Is it their anxiety? Is it, and careful about judging that the people, well, they're praying and it may not work. To not judge the client, to identify the core disturbed emotion, and to go back to exploring what are you telling yourself to create that emotion. Now, frankly, prayer can bring solace to people, and it might be helpful to not discourage the people from doing what they believe is appropriate in their religion and faith, but by questioning, not suggesting, but questioning, as if you want to learn more about it. Well, is there a way of praying that can help you feel less anxious and more hope? So if the individuals are not practicing any rituals that appear to be destructive, and if they're practicing some rituals including prayer that may be helpful, perhaps encourage them to utilize that in a way that brings greater hope and optimism and acceptance of any outcomes in life that are not the outcomes that they were praying for. To remind them that part of being alive includes suffering, challenges, and loss. And so to give a healthy perspective within the umbrella of their faith, focus on encouraging them to share with you what they can think of in terms of utilizing their faith to uplift themselves and others. I hope I've adequately answered that question.
Thank you, Debbie. Thank you for that.
It's not for us to challenge anyone's religion, but to help them if they choose to continue to use it, to encourage them to utilize it in the ways that serve them and others the best.
Great, thank you. Another question that has shown up is that Obviously, the stress of the pandemic has made it very challenging for some people. They're reaching out to therapists and are showing up in a very troubled state. What do you recommend a therapist do in just the initial 1-hour session? Who knows if there will even be more sessions, but what can someone do in that 1 hour to have an effect?
Perspective, perspective, perspective. This is not the first time in your life, in all probability, you might suggest, that things are not going the way that you want them to go. Encourage them to realize that it doesn't have to be terrifying if we're healthy enough and willing to focus more on the here and now and being compassionate and helpful and to choose healthy ways of living, eating, sleeping, exercise, and being. Again, coming back to in that one session, and sometimes one session will be enough, if they're willing to own what they're telling themselves to create the terror and anxiety. And then, as I've already mentioned, to dispute it and come up with healthy beliefs. The fact of the matter is that unless a person is severely debilitated one way or another, there's an immense well of resiliency and creativity that we can tap into in the absence of beliefs that we can't, or it's too terrible, or just not being aware that we have a choice. So in a one session, listen, empathize, compassion, remind the person or inform the person, listen, it is not the circumstance that's creating your emotion. If it was, then every human would feel the way you're feeling. Not every human is feeling the way you're feeling. Many are, and many are not. Why not? The ones that aren't have a different attitude. The ones that are probably thinking the same things. Then teach them to dispute. Teach them that they have the choice not to catastrophize, to accept the challenge that is, change what they can, accept what they can't, be creative, be compassionate, do for others. And to give them homework, such as the ABC form on my website that they do every day. Gratitude every day. Give them something to do after the session. Sometimes one session where you educate, motivate, encourage, inspire, be a model for the client can be enough. And give them books to read and healthy videos to watch so they can use this enforced restriction time. And this, of course, is in countries where people can afford to do it or have the technology to do it. So I'm talking to us privileged ones right now. The ones less privileged, play with balls and sticks and draw and you know, humans can adapt if we know we can and if we're not paralyzed by anxiety, panic, fear, depression, rage, guilt, and shame.
Great. Thank you. Here's another question, Debbie. Some therapists are working with people who are, for one reason or another, not complying with risk guidelines. Maybe they are fatalistic, maybe they're not processing the threat accurately. What does REBT have to say to support these people to engage in healthy behaviors?
Well, speaking first to the person who wants to support them to engage in healthy behaviors, as I often do when I'm on my walks and I see people jogging with no masks and no awareness of social distance, and I surely want to inspire them. I better not expect that I'll be able to change anyone who doesn't want to be changed. Now, if I have an opportunity to speak to someone who isn't following the guidelines, and I think there is a possibility, even slight, that they might be willing to hear what I'm recommending. I'd better be careful not to sound like I'm being judgmental or like a punitive parent or telling them what they should be doing. First, I'll try to understand why they're making the choices that they're making. And if there's no rationale behind them, I might, again, in a non-sort of judgmental way, sort of question me, can you help me understand this belief that you have? So to hear where they're coming from without judgment. I may judge the belief, but not damn the person for having the belief. You know, one of the principles of REBT is the reminder that every human has worth. Now, we may act in selfish or evil or saintly and good ways, but they're just behaviors. Behaviors can be changed. Where there's life, there's hope. Yeah? But inherent in every person is worth. So if I want to really have greater potential to have someone hear me, I better work on having unconditional acceptance of them as a human being, which doesn't mean I like what they're doing. I may despise selfish actions, but I work on not despising the individuals. Because if I'd had their upbringing and their way of thinking, I might do the same thing, and I'm grateful I don't. So then the next thing I would try to do would be to explain how the impact and the possible consequences of them continuing to do what they're doing. And might they be willing to consider modifying what they're doing for the well-being, the ambience of a society that's challenged right now? Depending on the person, you know, REBT and I think other therapeutic approaches aren't a one-size-fits-all. With some individuals, for their benefit, it works when I'm more assertive and in their face and a little more challenging. For others, including and especially those who I'm seeing for the first time, so I don't really know them well and they don't know my style well, and also others experiencing a raw grief at the time, you know. So in those cases, I certainly have a very much more gentle manner. So I tailor my manner according to my assessment of how they're best going to understand what I've got to say, so that if I'm not choosing an offensive manner, you know, or if I choose an offensive manner, they might just build up resistance. And so I would very much, if it felt appropriate, perhaps say to someone very directly, so how would you feel, even though you're feeling really healthy and well, that you unknowingly were carrying it, and that 6-year-old child that you're running by caught the virus, and they caught it from you? Maybe we would have no way of knowing. Maybe at one point there would be a way of identifying that. How would you feel about that? I would not say that to every client. Please hear me on that. REBT is effective when it's in your face with a certain kind of client who's well-versed in REBT, who has a certain kind of sense of humor and a certain assertiveness themselves. That's just one thing. For others, it would be more a call on their ability to be compassionate and put aside what they would prefer for the well-being of others. You know, are you aware when you do this, and you may not realize it, I might say, that there are some people who could be in danger, that there are some people who'd rather not be wearing a mask, but they are, and that can incite some unhealthy emotions in them, and that contributes to a more distressed society. Society is healthier when we cooperate. So I'm sorry if I'm a little long-winded. Different approaches with different clients. Choose a manner that they'll be more receptive to. Remind them actions have consequences. Remind them of the gift of being compassionate, that it's important to develop high frustration tolerance. I can tolerate not doing what I want, though I want it. I just don't like it. And using this limited period of time, in all probability, which will pass, to practice a greater awareness about others. Some suggestions.
Thank you for that. Debbie, we just have a couple of minutes left. What we would like to know, we would like to know, could you give everyone one or two either exercises or practices that they can give to their clients either in between sessions or to strengthen themselves after a session?
Can I suggest more than two? Okay, daily gratitude. I recommend, if they don't already, or I have a journal, it's good to write it down, and also throughout the day, hone in on what they can be grateful for. And if they're alive and able to see a therapist, they already have much that they can be grateful for. And to think of those things throughout the day. That's number one, gratitude, gratitude, gratitude. Then secondly, write down the beliefs that are creating their unhealthy emotions and dispute them, and come up with healthy new attitudes and beliefs that are realistically optimistic, and repeat them at least 50 times every day for the next month. To be creative, and if it's a client who's seeing you next week, and encourage them to show you how they have been, whether it's they've created a dance or done a drawing or whatever they've done, written a poem. Encourage creativity that they can share with you. And encourage them to do at least one action that can help another human being, even if it's just an online smile or a message of hope, to do something for others every day. So challenge the thoughts, do for others, be creative, gratitude, gratitude, gratitude. Oh, and write down a list of some of the benefits of this enforced time of restriction that we may not have paid attention to if we were too busy complaining about what we can't do. Let's think of what we can do more of, simply because we are restricted more now.
It's wonderful. Debbie, and this is I'm sure a question that will require more time, but we have people who have family members who are dying from COVID. Is there anything that you can say to them?
As someone who was literally in the room with my late husband, and then with my precious, precious mother, you know, when each of them passed away, and of course with them for the preceding time, months and years, my heart is with you. One part of being alive is that we lose people we love. And it's really important that we accept that. So while they're still alive, do what you can to cherish the moments now. If they are in isolation and you can't see them, you can't be with them physically, if they're conscious, it's possible a doctor or a nurse might hold up a sign for you or from you, or a photo or Facebook kind of message. Do what you can, accept what you can't. Now, the reality is in life, some people, they say goodbye to someone in the morning thinking they'll see them and forget the virus, or don't forget it. But in other instances, you know, the virus, as I've said a few times last week, it's not the only thing that kills people right now. You know, and their loved one is hit by a car or dies in some other way or commits suicide. The reality is, for many, if not most of us, part of life will be accepting that we won't always have an opportunity to be with our loved one when they go. If we can, it's a blessing and great. If we can't, at some point, either way, our loved one passes. So let us do the best we can to be stable, to remember that love is what fuels the depth of pain of grief. Focus on the love. And know that in time, you know, after they die, after a period of grief, it's different for everyone. We can choose to find meaning again and joy and laughter and still shed tears when we think of them. That's healthy. But while we have life, we can create meaning, even during a time we are losing, even after we've lost loved ones. That's the collateral condition of being alive, some loss.
Thank you.
Cherish our moments.
Thank you. Debbie, we have a couple people who have asked, would you direct them to your website? How can people access your website?
Sure. Excuse me, everyone, if there's some allergy going on. Again, you won't catch anything from me, and I'm blessed with very good health right now. My website, it's my 3 names, Debbie, Joffe Ellis, as one word.com. So www.DEBBIEJOFFE, not 3 E's, 2 E's, LL, I like India, S like Sam, Debbie Joffe Ellis, one word.com.
Thank you for this, Debbie, and thank you for this wonderful presentation. I want to remind everybody, we're going to be back next week at this same time, and please do log on to our website and enter your questions. We will do our best to present Debbie with every bit of information that we can. Thanks for everyone who's logged on. You will be able to access this information on the ICP webpage. And as always, thank you to Mary Bullock, who is behind the scenes making this whole presentation happen. Have a good week. We'll see you this time next week. Bye-bye.